In this video, we're going to be talking about the Dix Hallpike Maneuver and how it can be used to diagnose posterior BPPV. The Dix Hallpike Maneuver is used to diagnose benign paroxysmal positional vertigo of the posterior canals. BPPV is a common cause of vertigo, or the feeling of your head spinning. Before doing this maneuver, it's important to warn your patients that they might experience their symptoms of nystagmus, and this can include vomiting. So as a PT, it's important to have a bucket or something for the patient to vomit in case that happens. So to set up the Dix Hallpike Maneuver, first I'm going to have the patient sit in long sit on the treatment table. And I'm going to make sure I have a pillow behind the patient, just close enough to them that when they lie back, their head will be in about 20 degrees of extension. Now with the Dix Hallpike Maneuver, we're moving the head towards the side that we want to test. So in this case, we're going to be testing the left posterior semicircular canal. So I'm going to bring the head into 45 degrees of rotation, and this will put the left posterior semicircular canal in line with the sagittal plane. And then I'm going to instruct the patient to keep their eyes open as I bring their head quickly down, making sure to keep that head in 45 degrees of rotation. And what we're looking for is nystagmus. So we're looking for the latency, duration, and direction of that nystagmus. So a positive test for canalithiasis would be reproduction of symptoms. So the patient feels vertigo and may vomit, and also if the PT sees nystagmus. The nystagmus usually has a latency of 5 to 10 seconds and lasts less than a minute. We would expect to see upbeating and torsional nystagmus towards the ipsilateral side if you're testing the affected side. And this is because the crystals in the canals are still moving even though the patient is not moving anymore. So we're still seeing that nystagmus that would be expected if the head was moving. If we see any lateral or downbeating nystagmus, then we're going to consider testing for lateral and anterior BPPV.